Advances in dental implant technology are allowing patients to enjoy the traditional benefits of a fixed bridge, along with the advantages of a prosthesis affixed the same day the implants are placed. Dr. John Stella of Facial and Oral Surgery Associates in Fort Worth, using Noble Biocare's Noble Guide technology, is partnering with restorative dentists to provide patients immediate function, increased comfort, and faster healing with Noble Guide.
The procedure we're doing today is something known as Noble Guide. And it is a particular technology that adds CAD/CAM technology, which is short for computer-assisted design, computer-assisted manufacturing, and dental implant technology.
If you ever lose your teeth, it's a very upsetting milestone in your life. I went for a consultation with Dr. Stella. He explained the procedure and showed me a case that he was already working on. And I was just astounded at the difference between the old procedure and the new one.
Using any other technology and the amount of bone that she has, she would have been a typical patient just a year ago that we would have placed the implants with a traditionally made lab process drill guide without the aid of computers. She would have waited 4 to 6 months, and she would have had her teeth 4 or 6 months down the line. She would have also had a little bit longer recovery time.
My dentures are uncomfortable. They make me feel like I talk like Elmer Fudd, like I have mush in my mouth.
She loves to laugh, loves to smile. She's extremely animated. And many patients who are extremely animated do have difficulty wearing dentures. The first thing is that a lot of times with all the muscle movement, the denture will actually get loose. And the most embarrassing thing and socially distressing thing is having to avoid a lot of animation because you're afraid that the person you're animating to will actually see the teeth move. They may not fly out of the mouth, but even just a little bit of mobility in even the most perfectly processed denture is going to cue the person they're speaking to that these are fake teeth. And that's a devastating thing for someone to see. And so with the amount of animation I saw her with the vivacious personality she had, she makes a great dental implant candidate to make sure that they won't move and to give her the confidence to be able to keep that personality without ever worrying about her teeth moving. In this case, our preparation involved first her going to her restorative dentist, Dr. Bryant. He modifies a pair of dentures with small radiographic markers, just little tiny pink dots. We then meet her at a CT scanning facility, a medical CT scanning facility. We take a CT scan. That information from the CT scan is then put on a little CD-ROM, a little disc. That disc is given to me. I put that into our laptop computer, which has the Noble Guide software in it. And then up comes a three-dimensional representation of her upper jaw. I then take that information and I actually place the implants in the proper position using the Noble Guide software. And I can also check it against the actual result that we're planning. So I can put the prostheses, that is the teeth, on and off in the computer to make sure the implants are in the right place. Once I'm happy with my preliminary placement, I then contact the restorative dentist. They also view the position of the implants and they approve the position of the implants because ultimately this is a patient restorative dentist driven procedure. It's not a surgical procedure. The patient has to be happy with the final result and the restorative dentist has to be happy with the position of the implants. With this new technology, combining CAD/CAM technology, computer-assisted design, computer-assisted manufacturing, and this particular implant system, this Nobel implant system, the implant goes into the bone without ever making an incision in the gum. And so what that does, that allows the tissues to stay very, very tight over the bone, supporting the bone. So as the implant enters the bone, the tissue is acting as a restrictive force. So now the implants go in much tighter. The other thing that it does, it allows the surrounding soft tissue to maintain the blood supply to the bone. The more blood, the better oxygenation, the better healing, the higher rate of integration. If we get it at high enough torque value, which almost invariably we do with this technology, we can place a prosthesis, that is a set of teeth, on the exact same day.
This is an amazing thing that they can do for us, and I'm really looking forward to doing it. I can't wait to get up tomorrow and look in the mirror and realize that I don't have to put anything in a little box and soak it or anything like that. So it's going to be amazing.
Well, typically I used to tell patients, give yourself a week to heal up after the surgery. In this, she's going to be up and around tomorrow. Again, each implant is only put in through a small 4mm diameter access hole, no incision. And she's going to have a full fixed set of teeth. So anything that she could, put in her mouth and chew without actually cutting it is what's fair game. So I tell them meatballs, macaroni and cheese, well-cooked vegetables, baked fish, anything like that for the next 8 weeks she can eat. And then after that, she can have a porterhouse steak, our compliments.
I was very pleasantly surprised that it was as easy as it was. I love them. I can't tell you this is the best thing I've done for myself in years and years and years. I like the way they look. They feel natural. Now when I smile, it's my old smile. It's just the old me. And that is, at 57, you can't really get your little pieces of yourself back. This I did.